Usually, when we think of medications, we think of prescription medications. But remember, alcohol is also a drug. And when medications and even some herbals are mixed with alcohol, this can be extremely dangerous. Alcohol can make the medicine less effective or useless, or it can even make the medicine more harmful and toxic to the body. Some common things that can happen when you mix alcohol and medications are abdominal pain, which can include nausea and vomiting. You can also be dizzy or feel faint. You can have drowsiness or feel very sleepy. Headaches are another common symptom that you might experience if mixing alcohol and medications. Those with chronic health conditions may have further damage to the brain, liver, or heart. There is an increased risk for stroke, cancer, or internal bleeding. And other mental health conditions could worsen. Mixing alcohol with medications could further increase the risk of overdose and even death. There are a lot of common medications that are particularly dangerous when mixing with alcohol. The first is opioid pain medications such as morphine and oxycodone. Mixing these medications and alcohol can increase the relaxing and drowsy effects of the medications. There is a radical increase in the risk of overdose, and in a study conducted, it was found that combining even normal prescription doses of oxycodone with the equivalent of 1 to 3 drinks caused an extremely dangerous level of slowed breathing. The next class of medications where alcohol should be avoided are with benzodiazepines such as alprazolam, lorazepam, and diazepam. Benzodiazepines and alcohol act on the same receptor in similar areas of the brain. It is very dangerous to mix benzodiazepines and alcohol, as mixing them can significantly lead to poisoning, overdose, and death. The side effects that can present are increased and can quickly become dangerous. Another class of medications where alcohol can cause interactions are antidepressants, such as sertraline, fluoxetine, bupropion, and amitriptyline. Mixing alcohol in these medications can make the medicine less effective. Therefore, the overall feelings of depression and anxiety would persist. Cognitive processes such as memory or thinking can be inhibited. Like benzodiazepines, this interaction can cause excessive sleepiness and impaired motor control that could lead to accidents. There is also an increase in blood pressure with an increase in the incidence of blood clots and heart attacks. Similar to antidepressants, antipsychotics like Quetiapine and olanzapine can be made less effective by alcohol, so hallucinations and delusions may return. Drinking alcohol while taking these medications can also cause excessive sleepiness. We also can't forget our over-the-counter medications like ibuprofen, acetaminophen, medicines for cough and sinus, or medicines that are taken for sleep, as mixing these medications with alcohol can increase the risk of intoxication. So what can you do? Try to limit the amount of alcohol that is being drank. And also, if you have any questions, Don't be afraid to ask your doctor or pharmacist or talk to anyone at the Richmond Health and Wellness.